Hello, my name is Amy Dearmore, and I work as a policy advisor here at the Colorado Department of Healthcare Policy and Financing. I'm so excited to be sharing this video with you to let you know about a new program that will soon be made available to eligible members, which is Presumptive Eligibility for Long-Term Services and Supports. The acronym that we're using is LTSS PE. Before I begin, I want to identify an important goal we have in sharing this information with you at this time. Of course, we're excited to let you know about this new program and provide some details, but more importantly, we are looking for your feedback. You, as our stakeholders, are valuable partners for us here at the department, and we know that with your input on specifically a couple of key details, but also on the program as a whole, that we can create something that's really impactful for our members. I want to highlight our mission statement, which is to improve healthcare equity, access, and outcomes for the people we serve while saving Coloradans money on healthcare and driving value for Colorado. So a good place to start is, why are we implementing presumptive eligibility for LTSS? This program has been in the works internally for quite a while, but has been identified as an important goal for many stakeholder groups for much longer. Over the years, we've heard this feedback, we have heard these requests, and now we're really excited to have something in place to help meet this need. LTSS PE will further healthcare policy and finance's mission to improve healthcare access and outcomes for those we serve. This program will provide services and support right away to members experiencing defined crisis circumstances. The idea behind this new program is that members will be able to receive support during a crisis situation right away before their needs progress to higher levels of care, and help them avoid more costly levels of care. LTSS PE will allow the self-declaration of eligibility, allowing eligible members to maintain their preferred quality of life in the setting they choose. It's exciting to note that in June of 2024, the department received legislative authority through House Bill 24-1229 to pursue presumptive eligibility for LTSS, and this bill was actually signed into law that same month. Colorado intends to implement presumptive eligibility for LTSS through the expansion of our current 1115 demonstration waiver. In case you don't know, 1115 demonstration waivers allow states the flexibility to pilot new programs, provide different services, support new populations, as long as they meet some specific criteria, including meeting budget neutrality requirements and also furthering Medicaid objectives. Our current 1115 demonstration waiver supports the substance use disorder program. This waiver is up for renewal, and so Colorado intends to send a request to the Centers for Medicare and Medicaid Services, asking them for permission to expand our 1115 to include presumptive eligibility for LTSS. Our targeted implementation date is January 1st of 2026. With LTSS PE, applicants will be able to self-attest to program eligibility. We're currently looking at the best way to reach eligible individuals for this program, including using existing networks and existing processes. Identified LTSS services will be provided to eligible members right away. The services that we're looking at to help someone in a crisis situation may include personal care, respite, transition coordination, long-term home health, home-delivered meals, and personal emergency response system. Designated entities will facilitate the LTSS PE program while someone's long-term care Medicaid application is processed. For this program, someone's long-term care Medicaid application will be processed through current processes during the presumptive eligibility period. We believe that authorizing an entity to facilitate LTSS PE will allow county processes and case management agency processes to remain largely as they are. In fact, it's our priority to avoid any duplication of work and avoid increased workloads. Once someone's long-term care Medicaid eligibility is approved, LTSS services will continue through waiver enrollment, ensuring continuity of care. Here is what our plans for development look like. Through the fall and winter of 2024, we'll be finalizing policy details in response to stakeholder feedback. Part of the stakeholder feedback includes a formal review and comment period as mandated by our 1115 demonstration waiver application. This formal public comment period will be from September 10th of 24 through October 10th of 2024. By January 1st of 2025, we'll be submitting our 1115 waiver application to the Centers for Medicare and Medicaid Services. The spring through fall of 2025 will find us here at the department looking at our current systems and seeing where we need to expand and improve things to accommodate LTSS PE. Stakeholder trainings and support to prepare for LTSS PE adoption will happen through the summer and fall of 2025. And then our go live date will be January 2026 when LTSS PE will be implemented. When we were looking at the best way to implement LTSS PE, we did a lot of national research, and what we found in two specific states were especially promising. Washington and Rhode Island both offer presumptive eligibility for their LTSS populations through their 1115 demonstration waivers. Washington is especially robust with presumptive eligibility, offering 4 PE programs with future phases expected. Their LTSS PE program targets those who will be discharging or have recently discharged from a facility. The services they offer include personal care, nurse delegation, home delivered meals, personal emergency response system, and community transition or community sustainability. Rhode Island's eligibility program is sometimes referred to as expedited eligibility, and it targets those who meet nursing facility level of care and have obtained medical attestation or hospital discharge documents indicating the need for presumptive eligibility. The services that program offers include personal care, adult day program, skilled nursing if applicable, and transition coordination support. I want to highlight a key difference between what Washington and Rhode Island offer versus what Colorado aims to offer is that we aim to serve members who are in a crisis situation. I mentioned in the beginning that we want to hear from you about a couple of specific details, the first one being eligibility. This program will aim to serve eligible individuals in a high risk or crisis situation. The current criteria we are considering include loss or incapacitation of caregiver, having experienced a recent acute medical or mental health episode, being a danger to oneself or others, and or at immediate risk of losing housing. So our first question to you is, what criteria do you see as being important to include? We also want to hear from you about services. Those on LTSS PE will have access to a few LTSS services for up to 90 days to help support them through a crisis until a benefit package is approved. The current services we are considering include personal care, personal emergency response system, respite, long-term home health, home delivered meals, and transition coordination. Our second question is, what services do you think are important to include? We've established a few different ways through which stakeholders can remain up to date and also provide feedback. We have an LTSS PE website that will be updated as developments progress and updated with future stakeholder engagement sessions. We've created a Google stakeholder feedback forum that will collect comments and questions. There are a couple of questions on that Google stakeholder form that specifically ask about services and eligibility, but it also allows you to provide feedback on the program as a whole. We also have an LTSS PE email inbox where you can email your questions and comments. And all of our feedback, along with HCPUF responses, can be viewed on the LTSS PE feedback log. These live links will be made available to you in future publications or communications. I also want to mention that we are in the process of establishing an LTSS PE voicemail box for telephone use in case stakeholders don't have access to the internet but still want to provide feedback. Last but not least, I want to communicate a very sincere thank you. I appreciate you watching this video, and we appreciate your commitment to the wellness of our members. We know that the need out there for programs like this is great, And while LTSS won't be able to meet every need, we know that it's a promising start. We really look forward to hearing from you, and also we look forward to partnering with you as this program continues to grow and develop. Thank you.